I'm Dr. Anjum Rashid. In this video, I will talk about the care and management of a child with cerebral palsy. In order to take care of a child with cerebral palsy, multidisciplinary approach is required. It includes a pediatrician, nurse, nutritionist, physiotherapist, neurologist, psychologist, orthopedic surgeon, speech therapist, a social worker, and an occupational therapist. Now, a good nursing care is important for tube feeding, skin care of bed sores, nappy rash, and care of aspiration pneumonia. Second important thing is the physiotherapy, occupational and sensory therapy. These enable the child to perform activities of daily living, include dressing, washing, toileting, feeding, and positioning. Now, it is important to evaluate for sitting and bathroom fittings and furniture for better lifestyle. Now, three-dimensional gait analysis is used to detect primary movement problems. Sensory therapy for children less than 6 months can be done. In this, colorful lights or toys are shown to the child to attract and help him to hold his neck, move, and interact with the surroundings. Now, occupational therapy with splints and orthrosis include constraint-induced movement therapy, intermittent immobilization of the good part so that the child uses the affected part. Serial casting over 2 to 6 weeks can be done. This causes gradual stretching of the calf muscle. In a cerebral palsy child, soft and hard arthrosis or splints can be used. These act as exoskeleton and prevent contracture development. Soft arthrosis are made of high-density foam and they are used for low-tone cerebral palsy. Hard ankle-foot orthoses are most commonly used after three-dimensional gait analysis. These improve gait and prevent deformity. These are of 3 types: fixed, hinged, and in-shoe orthosis. Now, in a cerebral palsy child, night splinting is also beneficial. It prevents contracture and allow good muscle growth. Now, adaptive equipment which are very useful for a cerebral palsy child include walkers, poles, standing frames, wheelchair, talking typewriter, speech generating devices, and modified feeding devices. An important management step for the cerebral palsy child is the home modification. Furniture, bed, and bathroom fittings should be adjusted for better lifestyle of the child. Now, in order to control the spasticity, advice for regular physiotherapy and the drugs which can be used include diazepam and DROOLING. Botulinum toxin is also used for the control of spasticity in cerebral palsy children. It is effective for localized and segmental spasticity. It is an anticholinergic and given intramuscularly, it prevents the release of acetylcholine. There are 7 types of botulinum toxin and clinically A, B, and F are used. However, botulinum toxin A is most commonly used and it is used for dynamic contraction in the absence of fixed deformity. Duration of action is about 3 to 6 months. Side effects of botulinum toxin include local pain, muscular atrophy, deterioration in walking, local weakness, increased fall, aspiration pneumonia, dysphagia, and urinary or fecal incontinence. Intrathecal baclofen is also used to control spasticity in cerebral palsy children. It is given by a pump which is implanted in the anterior abdominal wall. It connects to a catheter inserted in the subarachnoid space overlying the conus of the spinal cord. However, the patient needs monthly appointments to refill the pump with IT baclofen. Surgical procedure for the control of spasticity include selective dorsal rhizotomy. In this, dorsal spinal rootlets with increased activity are identified and are transected. A new thing for spasticity control include repetitive magnetic stimulation with gabapentin, and it is usually used in adults. Now, levodopa can be given for rigidity. Trihexyphenidyl is given for dystonia. Reserpine or tetrabenzene is given for chorea and athetosis. Stereotactic basal ganglia surgery may improve rigidity, chorioathetotic movements, and tremors. In a cerebral palsy child, seizures are controlled by anticonvulsant. These include diazepam, phenobarbital, or carbamazepine. Orthopedic procedure for the deformities and contractures in a CP child include adductor tenotomy, hamstring release, iliopsoas lengthening, lengthening of the tendo agilis, single event multilevel surgery, osteotomy, open reduction, salvage arthroplasty, hip replacement, upper limb surgery for flexion pronation deformity of the wrist. Cerebral palsy child is usually malnourished and has growth failure, so nutritional rehabilitation is very important. Constipation is treated with soft high fiber diet and laxatives can be given. He may need tube feeding or gastrostomy tubes should be placed. A cerebral palsy child is prone to respiratory infections, so oxygen nebulization, chest physiotherapy, suction and antibiotics should be recommended. Drooling and excessive salivation because of the bulbar dysfunction is common in cerebral palsy children. For this, following treatment can be given. Keep ice cubes in the mouth of the child or place honey on the lips. The child will exercise to lick it. Anticholinergics like glycopyrrolate can be given. Ultrasound-guided botulinum toxin A injection can be given in parotid or submandibular salivary gland. Now, surgery include transplanting salivary gland duct into the pharynx or salivary gland removal or resection of the chordae tympani nerve. Cerebral palsy child has usually visual impairment, so referral to ophthalmologist is important. Spectacles are given for refractive error, and for squint, patching of the good eye or surgery is important. For decreased visual acuity, magnifying glasses or Braille methods are usually applied. In some severe forms of cerebral palsy, hearing impairment may be present. In mild losses, usually no intervention is done, but in moderate and severe losses, hearing aids may be required. Now, in profound loss, special education for deaf is given. If there is serious otitis media, ENT referral should be important, and suction, laryngotomy or insertion of ventilation tube may be required. Now, cerebral palsy children with speech abnormalities should be referred for speech therapy. A good time should be spent with the child. Financial and social support for the child and the parent is important. A social worker should discuss in detail the problems of the parent. Now, for the behavior abnormalities like attention deficit hyperactivity syndrome, autism or depression, the child should be referred to the psychologist. In cerebral palsy children, schooling is also very important. The child should be admitted in special educational centers. Initially, he should be sent for 2 hours and then 4 hours and then normal schooling should be done. Thanks for watching this video.